So you mean the Romanian health system information on that? I think some of the things that when I was coming for this conference here, I just realized that there are a lot of public domain information systems that exist. For example, there is a database where you can actually look at a forecast of the next 20 years, how or what the disease burden in Romania will be. And when I was going through that, it was interesting to see that the top 10 conditions in Romania are all non-communicable diseases. So you have to cater to hypertension, to stroke, cardiometabolic diseases, cancers, a lot of them, like lung cancer was on the top of the list, then breast cancer, another. And I realized that one good thing, the positive thing, I'll start with that, is that from where Romania is right now to what we are expecting in the next 20 years, there is not much of a downgradation of any disease or upgradation of any disease. What the plans are right now of the National Health Strategy, which is, I got to know from the minister that it will be passed today, if we actually work towards implementing it and successfully implementing it and sustaining it, we will be at a good position for Romania to prevent a lot of these diseases, to avert a lot of mortality and morbidity, because these are non-communicable diseases. If you look at the risk factors sooner, then that is something that you can prevent, and the treatment can be prevented. So that is one way of looking at the information. There are a lot of health strategy information published in Romanian context. But yeah, there is a little bit of a gap of what currently is happening, and that is not out there publicly available, like in the nation. Could be because of language barriers, could be because of people not being able to access those sites. Some information exists, but it will be good to have a lot more information from the country context on what the plans are for the other world to see as well. So I 100% agree that, these are conditions, the top 10 conditions that you look at right now and even going forward are the ones that you can actually prevent. And preventing those would mean one thing, having people educated that you can prevent them. So they go for testing sooner, they go for screening sooner. And if you were to invest on those, then people living a better quality of life is going to increase. So if you increase people having that information that I can prevent getting a stroke in the next 20 years, I can prevent getting a cancer if I were to get screened properly, if I were to get my vaccination, if I were to get imaging done. So that is a good news, because in the middle of the pandemic, we saw that everybody was hit equally. And that was something that we could not really do anything about. If we were diagnosed, we needed treatment. But here we have the opportunity, especially in Romania, where if you have the knowledge, if you have education, if you advocate, if you have good lifestyle, like good diet, good healthy exercising, etc., you can prevent a lot of these diseases and disabilities associated with it. So we have heard that people who have diabetes or who have hypertension, they are at a higher risk of having other comorbidities. So it is better to work on that condition itself rather than then declining the quality of life further. So, there is one of the pieces that I would definitely agree to, that somebody in the panel also said, people at younger ages need to have that information on why do I need to take care of myself? Why do I need to have a better lifestyle? Why do I need to exercise? Why is it that I need better diet? Because if they know what the repercussions of not doing all of this is, they're probably going to invest more of their time in getting healthier at the younger age of life. And that education, I think, is something that needs to come, one, from the child getting educated at home, but then also in the school systems, in the colleges. So the innovation is moving where people can actually sit at their home and get tested. So we have now glucose monitors that people can wear, and they can look at their glucose levels at daily basis. So if something like that innovation is moving where people can sit in their homes and be able to screen or look what is happening, then we also need to make people aware of what does that mean. Oh my God, my sugar was shooting up to this level. Now, am I going to die? What do I need to do? Do I need to get on treatment? So that education of what is important to prevent. And then if there is a condition, how to then actually control it. That information needs to flow in from starting from home to schools to colleges. And then even it is important to advocate that people doctors, practicing doctors, need to be able to communicate to patients that if you were to do this, then you will be able to prevent this, you will be able to prevent that. And I think this is something that is an ongoing process. It needs a lot of reiteration in the education system as well. Yes. So if we were to see that across all conditions, if you look, whether it is an infectious disease or it is a non-infectious disease, the biggest gap is the diagnostic gap. And looking at the data from all across the globe for many different conditions, we have seen that regardless of what the condition is, regardless if it's a low income country or a high income country, we actually don't even know what we are treating the patients for. We are just shooting a guess saying, you have cough, you have fever, probably you have TB, probably you have pneumonia. Let me just give you some antibiotics and see what happens. But if we really need to get away from that, because that is causing a lot of antimicrobial resistance across the globe. And if we were to decrease that resistance, we really need to start investing in diagnostics. Because without knowing whether I have a disease or I'm at a risk of having a condition, we are actually running in blind. So we are not treating them for what they need treatment. So diagnostics is the biggest gap, and that is where we need the highest investment in case of in terms of money, in terms of education, in terms of advocacy, in terms of policy, for all of this, because without accurate diagnostics, there is no efficient treatment. So I would definitely say that to close that gap, we need investment of all sorts, from the political will to actual tool.